not only for the wonderful contributions here, but what the leadership you're providing across the board. We're now going to move to closing comments, first from the chair.
Drinks, right? Is that the next one we go to? No, I just want to take a couple of minutes to thank everyone. I think this was a great discussion and in some sense gratifying of all the work that we put into drafting the report and having the workshop. So it's incredibly gratifying to hear the building blocks. I just want to share 4 reflections I have kind of on the day of what I heard. The first is that we need more perspectives and different perspectives. So certainly more patient engagement. Not more cowbell, but more patient engagement in a different and deeper way, and starting with the patient. We still, I heard, are system biased in some of the report, and we are health system biased. So the community perspective on its own, not mitigated through the healthcare system, is a second perspective. Biospecimens and a whole new world of precision medicine is a place that we were stopped short of, and I think adding out our perspective there. And then the outside-in perspective on social services. So not I call it the Death Star of healthcare, that we suck everything into healthcare and our Death Star, but having a social service or behavioral health be its own frame, just like community has its own perspective in region. So those, I think, are a growth area for the report or for how you would think about where to go next. The second, I heard a lot around drilling down on gaps. And one gap may have been different segmentations and different 2x2s that we did some cross-mapping. There's much more that can be done that would be fruitful. Drilling down on segmentation stratification. And I can assure you that Ashish, Jose, and I probably had hours of very geeky conversation about the difference between stratification and segmentation. And could we even do this, and were we worthy in the sense when health plans could do so much more stratification and do it differently? But I do think we need to keep that clear and what the purpose of it is. We need to drill down on the data gaps. Bruce's point, the other points around new and different data and where do we go. We were limited in some sense by claims data and what we had, but that shouldn't be our limitation going forward. You have to say that's our limitation today, but that can't be the limitation going forward. Thinking about other models globally, certainly we need more evaluation. Just because we're saying it's an inflection point and we're all comfortable moving forward is not the same thing as saying we have complete evidence or that our evaluations don't need to keep continuing and looking at different and new models and continuing to understand what works better. Certainly thinking about equity. And then I'd say the big takeaway for me is, and maybe this gets back to the segmentation stratification, but thinking about that impactable, modifiable within your segments. And so that's really what makes it actionable, is how do you get to that core set of people who are most ready to change on the trends theoretical model, not the pre-contemplative, but the places where you could have impact. And I do think we need to get clearer, just even in our language going out around this is high need, not high use and not high cost, and really being clear about that this is for a high need population, which I think does help ground you in the person's experience. The third I would say is, now that we've come together and are a team, and Pastor, thank you for your comment, we should stay a team. If we go, we will have the dystopia that Jeff pointed out if we come back in 2024 and have another meeting or a conference about it, or worse yet, in 2034, we have an archive where we dig up this report and figure out what we've done. So I do think the playbook is one example, but tying together the clinical research work, the CMMI work, so that from this point forward, this marks a starting point, and that people at least commit to sharing information, coordinating, learning from one another, being open about what's happening. Because if we don't, we really are in jeopardy of reinventing this or dissipating the energy. So I think this is, I'm hearing a nice opportunity of pulling a lot of different threads together and taking disparate work and having it come together. If we all go back out and are disparate again, I think we've lost the momentum that we've built. And then I would close with, I think, Melinda's comments, and we didn't talk a lot about the policy environment today, but to me, we both have to have a sense of urgency. If the system is failing today with the Affordable Care Act and with that framework in place, repealing and replacing that with something less generous, with less money, with Medicaid in a very different state, has the potential to be even more challenging for the most vulnerable population. And so we need both a sense of urgency for the immediate as well as the 30-year arc. And so that, to me, is the trick about taking this work forward. What would you prioritize around outcome measures, potentially, or around how do we accelerate as quickly as possible getting care models in place such that we may have a lot less money and people may have less protection under the law? How would you get those care models out? How would you accelerate those things that are going to be most helpful in a less resource-rich environment, and a more challenging environment, at the same time not losing track of the 30-year, hopefully 20-year arc that we are building? And I do think that's an immediate next step, which is assuming the policy direction continues as it's headed, what are the elements of this that are most urgent to build resiliency, to do that work, while not becoming shorebirds that we lose focus on that we really are on a 20-year arc to change the way we deliver care in this country. So to me, it's about those four things: more perspective, drilling deeper on those certain areas that you all raised today, continuing to be coordinated and acting as a team, actually us exhibiting some of those attributes, us as a field exhibiting those attributes that we put up on the chart today, and then finally balancing that sense of urgency with a commitment to making sure that we are building for the long term. I think if we're able to do those things, then this report really will be the beginning of something that's actually powerful and different, and that will make a difference. I always say to my team, I want work such that people in the world recognize their lives are better because of our work, and I think that's the ultimate goal here. And I believe if we do those things, we will maintain this momentum and actually take the good work that was done by the Planning Committee, the National Academy of Medicine, Peterson Center, Harvard, Bipartisan Policy Center, and Commonwealth, and turn it into something that is materially different and materially better. So that's my kind of summation of what I heard from the groups today, and then my charge forward. I don't know if I'm the permanent chair. I don't think so. I could self-appoint myself the chair of all things, but I'm committed. Our foundation will continue to work on many of these elements and committed to kind of working and partnering with each of you to take this important work forward. So thank you all, and I will turn it to Jeff for our final words before the real drinks.
Yeah. Thank you. Thank you, Peter. Just a few comments. First of all, Peter, we're in as far as continuing to work together. I can't see it being any other way. And what a disaster it would be to start with a whole new set of relationships. I mean, why do that? So there's a principle that we have at the Peterson Center that I'd like to iterate now briefly, and the principle is learn by doing. And we think that the work here has been so effective that we're ready to learn by doing. So what do I mean by that? Well, first of all, there's this value proposition that we always think about when we're doing, and that is, will it improve clinical and functional outcomes? Will it improve the experience of care? Will it raise the engagement of clinicians and other people who are providing that care? Will the total cost of care be reduced? And do we know the cost and risk of the investment in making the transformation at whatever the scalable unit is? And I'm not sure I know what the scalable unit is. I could say it's a primary care practice. I think we could say maybe it's City Health Works-like organizations, or it's a community-based organization. That's work that we need to think more about. But what we will do over the next 12 months at the Peterson Center, in collaboration with anyone who would like to collaborate with us, is dog-ear this thing. Really pour through it and ask ourselves, what are the features that we can unpack? What are those elements, those future state functions that we can work with a limited number of scalable units to try to replicate these features and really understand the how-to? And then spread that information, whether it be through the playbook and the 5 foundations, or it be through a more or a larger spread effort. But I am very, very confident that we have enough here to try, to learn by doing in the replication. Now, is that going to be remodels of existing efforts? Are these going to be greenfield projects? I don't think we know yet. But I really do worry about this great, great work not going where it needs to go. And I love the group that's in this room right now. but I don't want us to continue to talk to ourselves. It's time to look outward in our respective organizations and apply what we've learned. So Michael, thank you so much for creating this platform for us and the work that NAM has done on this.
Well, thank you, Jeff, and that's all I want to say is as we move to the next room and continue our celebration of the product and our celebration and anticipation of the work that's yet to come and the pledges that we all heard about interest in moving forward together, I would ask that we close this phase and move to the next opening phase with an expression of appreciation to everyone involved in this project, and especially to the Peterson Center for Healthcare who got us started. Thank you very much.